Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access at stepsforward.org.
Hello, and welcome to this episode in the AMA Steps Forward podcast series. This is your host, Dr. C. Chen, Physician Director of Practice Sustainability here at the AMA. While there has been a great deal of focus on federal efforts, states play an important role in enabling sustainable implementation of integrated care, helping deliver high-quality, cost-effective care to their residents, particularly those with comorbid physical and behavioral health conditions. To explore how states across the country can help promote more holistic, integrated care, I'm joined today by Dr. Cassie Littler, Medical Director of the Webb Pediatric Specialty Clinic at Denver Health, a federally qualified health center serving the Denver metro area. Dr. Littler also serves as the Fellowship Director for the Pool Pediatric Fellowship for Advocacy and Health Equity, where she mentors future leaders in pediatric advocacy with a focus on equitable behavioral health integration. She was recently selected as Colorado's representative to the National Convening on Healthy Mental Development by the American Academy of Pediatrics. Thank you so much for joining us today, Dr. Littler.
Thank you. Thanks so much for having me. It's an honor to be here.
Before we get started in earnest in talking about these topics that we have at hand, would you mind telling our listeners a little bit more about yourself and your background?
Sure. As you said, I'm a community pediatrician at a federally qualified health center. That's where I do most of my clinical work, and I'm the medical director of pediatric specialties there. I'm an associate professor of pediatrics at the University of Colorado. And prior to my work here at Denver Health, I was a community pediatrician in private practice in a rural area on the western slope of Colorado. It's kind of a geographically isolated and more under-resourced area of Colorado, where I spent about 12 years working and really saw the benefit of integrated behavioral health, which we can talk about shortly, but really worked to build an integrated behavioral health pediatric program there. As part of that work, I was consulted to do some implementation for the Colorado State Innovation Model Program with the University of Colorado. And that was really to focus on transforming primary care, including the integration of behavioral health and mental health into primary care practices and implementing payment models to support that advanced primary care. And then, as you said, the last thing I'm really excited about is this recent fellowship director position for a really innovative and new advocacy fellowship for community pediatricians who are just really actively working in the field, looking at their community and feeling like they want to do something in the realm of advocacy and integrating behavioral health. So it's to help them learn to either start an integrated behavioral health program or expand services in an equitable way to better serve their communities.
Thank you so much for sharing that breadth of experience that you have. And thanks for being here to talk about these topics. So I'll jump right in. State and government policymakers are taking different approaches across the country to empower physician practices to sustain and integrate behavioral health care into primary care. In your home state of Colorado, what have been the most successful strategies that you've seen? And what were the factors that had contributed to the success of the different varying programs in your state?
Yeah, I appreciate this question and kind of focusing in on Colorado because every state is different and the setups are going to be different and the keys are going to be different. But for Colorado, I think really there's some, maybe three key strategies that have led to really impactful change in Colorado. The first, I think, is really having a shared vision throughout the state. And that is having engaged leadership that really guides lawmakers and policymakers to strive for those changes that support and really sustain models of integrated behavioral health. The second is paying for the infrastructure and not just the infrastructure, but the ongoing sustainability of these programs. So once you set them up, how do you sustain them? So upfront money and stable ongoing support. As well as the last thing is funding for implementation, not just at the state and policy level, that technical assistance is really important there, but providing technical assistance at the practice level.
Thank you for sharing those sort of key factors in success, especially in Colorado. I'm sure that those also come into play in other states across the country. I want to touch a little bit more on the shared vision aspect of things that you just talked about. I think that that's critical. How did you or your colleagues sort of formulate that shared vision, and how did that sort of get disseminated throughout the state and have different stakeholders buy into that shared vision?
Yeah, I think, this is ongoing work from my colleagues way before my time, but I think everybody has seen how important integrated behavioral health care is, not just for, the human connection and how important it is for the clinical care, but the return on investment, the long-term return on investment and the short-term return on investment. And so I think that work of sharing that knowledge with our policymakers and our lawmakers has been really important. So back in about 2013, we were lucky to have a governor who, really focused on the state of health. And they provided a report called The State of Health. And the goal was to make Colorado the healthiest state. And as part of that, they really focused on integrating behavioral health, promoting prevention and wellness, and expanding coverage to access, including integrated behavioral health access. And so that shared vision, by the leadership at our state and subsequently the leaders across the state was really important. And that consistent engagement with the state leadership is really important as well.
Yeah, it's great that you did have that buy-in from upper level leadership, including the governor, and I'm sure that helped pave the way for that future success that you had. So I'm glad to hear that that piece of things worked out for you in your home state of Colorado. As Colorado and other states push for more integrated behavioral health services, how are they working to address challenges like funding disparities, workforce shortages? I think, you talked about paying for infrastructure through different areas. How have you in Colorado been able to address those challenges specifically, and in general, if you have any insights through other states, how have other people been doing it as well?
Yeah, these are really important challenges that need to be considered on a state by state basis, especially now that funding for really vulnerable populations, such as those on Medicaid, in my case, kids, youth with complex medical and social needs, people with disabilities, that funding is likely to change and decrease. So as that funding federally decreases, it's important for states to think about how we can meet the needs of the people within our communities. So as I said, in Colorado, we've had this kind of shared vision for a while. Back in 2019, state legislature passed a bill that created something called the Primary Care Payment Reform Collaborative. And I think having a collaborative within a state is really important to help push and address these changes like funding disparities and workforce shortages and all the things that affect a state in the metro areas, in the urban areas, as well as in the more rural areas. And so this Primary Care Payment Reform Collaborative, the PCPRC is how we refer to it, because everything has to have an acronym, but it was actually convened by the Colorado Division of Insurance. And it's really the only place where all the people are in the room together. So we have payer representatives, we have provider representatives, we have healthcare consumer advocates, and convened by the Division of Insurance. And our goal is to make yearly recommendations about how to develop strategies for increased investment in primary care. And initially, we just talked about what is the definition of primary care. And what that really meant is advanced primary care. And that included integrating behavioral and mental health services within primary care. And so we have an annual report that we provide just talking about how much each payer is investing in primary care, including these models of integrated behavioral health. We look at it, we report it, and then we make recommendations on how to really intentionally support key components of this investment. And so, the fifth annual report was really focused on integrated behavioral health. And so as part of that recommendation, our very first recommendation was that all payers have to intentionally support it. So just making sure that, we call it out. And then the rest of the report was to talk about bolstering workforce shortage issues, encourage payers to support strategies like incorporating non-clinician providers as part of the whole person and whole family care model, and just making sure that we hold payers and providers accountable to these metrics. And that's really how we can promote change and create this sustainable model and think about those things like workforce shortages and how we can address them.
That's great. I'm very glad that you pointed out the power of working in collaboration and having a collaborative. As you know, we at the AMA have convened a behavioral health integration collaborative. And I think a lot of this work has been trying to get all the key stakeholders at the table to talk about these very difficult to implement issues, but trying to get through those and provide resources for all those involved. And so I think that's a very, very powerful thing. But, I think the other power of having collaborative and having all the stakeholders at the same table speaking with one voice is on advocacy pieces. And so I was wondering how your own advocacy efforts in Colorado with you and your colleagues, fellow physicians, other clinicians, how have you been able to shape state policy on behavioral health integration? And like, what barriers have you faced at the state level, and how have you been able to sort of overcome those with your advocacy?
Yeah, I think the way that we really have been able to shape policy in Colorado is to show up. Our motto is flood the room, right? If there's a stakeholder meeting, we're there. We have somebody there. If there's any, webinar, if there's any sort of place where policy is being talked about, we make sure to have, someone there to give some guidance or at least experience and stories about what these policies do when they're implemented. And so that's our motto, is to show up. And not just, physicians, but our colleagues that we work with. So having our behavioral health specialists in Colorado, we have, and this is a national program, our Healthy Steps, which is infant mental health specialists, making sure those programs and programmatic specialists are in the room to say, this is important and this is how we do it. And so we really try to give our pain points as well as provide those possible solutions without not always trying to complain about everything and say, we need more money, but really thinking about the biggest impact. So our policymakers in Colorado, they know us well, and now they sort of reach out to us for advice early and often now because they know we're going to show up and give it anyway. So just a few of the things that, that we do as physicians and behavioral health providers. Like I said, the Primary Care Payment Reform Collaborative, we make sure that we have someone on that collaborative at all times. In fact, we helped to pass the sunset legislation this year to make sure there's an actual pediatric seat on the collaborative so that our voice as pediatricians is being heard. In Colorado, we have a model with our Colorado Department of Healthcare Policy and Financing, which is our kind of state Medicaid department, where they're implementing an alternative payment model. And for 15 years, we've been talking to them about how pediatric payment models are different and focus on prevention, promotion, and early intervention, and not necessarily on chronic disease. And so they created the payment alternative for Colorado kids, which is being implemented in July. And several of our pediatricians have been on the design review teams for that program to help really guide and give some feedback about how these policies affect kids in Colorado. We make sure there's people on advisory committees and people on really boring rules meetings because, legislative work is really fun and interesting to do, but the important work really happens between session when the rules get made. And then the biggest impact, I think, that we've had is, at least from the pediatric perspective, is that we've had an informal meeting with our Department of Medicaid every month for the past about 15 years or so. It's been pretty consistent, and it's called Breakfast with HCPF, which is our Healthcare Policy and Financing Committee. So where we just talk about, all of these things and bring to their attention the importance of that collaboration. So not to say that we haven't had big barriers, but, funding is always a barrier. Differences in opinion about implementation and best practices, those can be barriers. But working together to try and make the best program that we can for children, families, and patients is our highest important piece of this. So
that's awesome. It's so uplifting to hear of all of your wins in this area through showing up consistently. It sounds like this has been a consistent effort with some key stakeholders that you're always in that room talking about these things and sharing your stories as well. So I think I'm glad that we had this opportunity to hear about those things and celebrate your achievements and wins. So that's awesome. Switching gears a little bit, diving into the weeds a little bit and talking about some of these technical things, the policies, the rulemaking. I know that there's a lot of data sharing and technology that has to happen for behavioral health integration. It doesn't magically just occur. It has to be tied through technology and data sharing. How has it been in your experience? What are the things that help implement these points? And do you have any examples of how data sharing and technology has either paved the way or smoothed the road to behavioral health integration, or on the converse side of things, how has it been difficult to sort of overcome?
Yeah, I think data sharing is really important, and that's a key component of it. Integrated behavioral health is to be able to, share patients and share communication seamlessly in order to provide that comprehensive care. And so I think when we first started doing integrated behavioral health, we have separate systems where, the behavioral health therapist is documenting in one system and physician, provider, advanced practice providers are documenting it in a different, platform. And so how can we share that information and make real-time decisions on care to provide the best care for patients and families? And that takes a lot of work and a lot of thinking through how to connect the platforms. And really, I think the key to that is infrastructure payments. So part of what the state innovation model did for Colorado when we first started is it provided these upfront payments to really help, if you have an integrated behavioral health clinician, you need to buy, access to your EHR so that they can log in and have that access and be able to document within the same platform so that it's all in one spot for everybody to see and everybody to access. And so that takes a lot of effort and a lot of money. And so the upfront payment to providers is really important to help create that infrastructure. And then just providing, like I said, the ongoing sustainable funding to continue to provide that care is really important. And so because we had the state innovation model for several years. It was a lot of grant funding. It did provide a lot of access, but then that funding goes away. And so how do you continue that technology? How do you continue to share data when you don't have funding to continue to provide that care? And so that's when the state of Colorado then sort of said that was a great model. The state innovation model did a lot of fantastic work, provided some framework, some learning. And so then they did a pilot program. It was primarily for pediatric and rural practices to kind of give them additional funding to on-ramp and provide that integrated behavioral health care. And so again, providing the infrastructure funding and the technical assistance funding. So that pilot program that started in 2022 really provided technical assistance funding to show the practices how they can connect and look at metrics, look at data sharing, look at communication, and really make more robust advances in integrated behavioral health care.
Great. Thank you for sort of walking us through that sort of more technical piece of policymaking and sort of advocacy as well. I did want to sort of bring that, those large policymaking impacts to sort of the individual, especially because, you're a practicing physician. How have those policies at the state level in behavioral health integration helped you in your clinical practice do a better job caring for your patients? And can you share some impactful patient stories?
Absolutely. I have integrated behavioral health specialists in my current practice. And as I said, I had it in my community practice on the western slope of Colorado. And I just am not sure how I would go about my day without the support that they provide. There's so many impactful stories from promotion, prevention, just providing that extra time and care to families who have questions about development, about behavioral supports for their children, sleep, all of those things that I wish I had hours and hours to spend with families to really guide them, give them advice and best practices. It really helps to have the behavioral health specialist in the room to say, you know what, my behavioral health specialist is an expert in sleep training. And so I'm going to have her come in and give you that advice. And then you can call her in a couple weeks and kind of, tweak what you're doing if the things that you're implementing are not working. So having that care available to my patients it's really important and makes such a big difference. We screen for pregnancy-related depression. So I think those supports for new parents is really important at a time when there's big changes happening in their life. So it doesn't always have to be a crisis intervention. It doesn't always have to be something where we're trying to figure out where we can transfer a child or youth who's having a really hard time. But it can really just be a developmental or behavioral support. It improves patient care, it improves satisfaction, it really improves physician satisfaction. And, if you're thinking about the return on investment within your organization, it does improve productivity. When it's working well, you can provide more support to more patients. So it does increase that productivity. But really, the last thing I'll say is that I've learned so much from my behavioral health specialists. So I can now do some of the interventions that they would typically do within the practice. And so, just that collaborative learning, being in the room together and saying like, oh, wow, that's a great tip. I'm going to, utilize that for the next patient that comes in the door. So then I don't have to utilize you the next time a patient with a similar question or problem or diagnosis comes in the door. That ongoing learning is really helpful.
Well, thank you for that personal anecdote. I've had similar experiences in my practice as well. So yeah, we're always constantly learning and trying to deliver the best care for our patients. This is kind of off kilter, but have there been any downsides in adopting some of these policies that have been enacted by your state?
Yeah, I think, well, the biggest is, I wish that we had more behavioral health. And so the workforce issues are real. And so, how can we incentivize behavioral health clinicians to go into integrated care? Because that's, when they could open a private practice and get paid out of pocket fee for service, directly from patients. That is the downside, is just trying to figure out how to incentivize this really important integrated care model to meet patients where they're at when they're already coming into the doctor's office. So that's one downside, is just I see how great it is and I want every patient to have it. And so that's something that obviously we'll need to be working on.
Yeah, there's a little bit of moral injury, knowing what you can deliver, but not being able to deliver it, that's for sure. So in closing, I wanted to ask you if there were any pearls of wisdom that you could share with our audience, if they're, regardless of whether they're, just starting their journey into behavioral health integration, or even if they're sort of seasoned and already a pro at this. What can you tell our listeners that has been most impactful for you?
Yeah, I think just consistent engagement with your state leadership, with your community, within your organization. So consistent engagement, making sure that you show up, like I said, even if you don't have the answers, being able to give some boots on the ground kind of stories and guidance is always key and important. And then just thinking about, when you're implementing, or if you've already implemented, what supports do you think that you need within your own practice that could be relevant at the state or national level? So that upfront money for implementation of infrastructure, the ongoing learning and collaboration, and funding for technical assistance, and just thinking about how to collaborate amongst your state and local leaders in your community.
Thank you for that wisdom. And I love that. Showing up, show up. Dr. Cassie Littler has been our guest today. Check out the episode description to explore the resources mentioned in today's episode. I want to thank you so much for coming and talking with us today on this very important topic. And this has been a wonderful conversation that we've had.
Thank you so much for your time and for doing the podcast today. I really appreciate it.
And thank you to our audience for listening and showing up. And until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.